This presentation is on the effects of posterior pituitary damage after a traumatic brain injury and its effects on water balance in the body. As you can see, we're not at all salty about the two of our group members who left our group.
So what is DI? DI stands for diabetes insipidus, the condition where the kidneys are unable to conserve water. Normally, the conservation of water is controlled by the secretion of antidiuretic hormone, or ADH for short. It's also important to note that it is also called vasopressin. Both terms are used interchangeably. So how does ADH work? So your body will filter about 180 liters of fluid per day. About 10% of that will try to leave in the form of urine, so about 18 liters. When your body is dehydrated, ADH is released and makes it so that 18 liters isn't released in the form of urine. Instead, it is reabsorbed by the body. In individuals with DI, the kidneys are either unable to respond to the hormone being released, or the hormone isn't being released in sufficient quantities. In this presentation, we'll focus on patients with DI that resulted from traumatic brain injury. ADH is produced in the hypothalamus and stored in the anterior pituitary gland. Due to their head injuries, ADH is either no longer secreted or not secreted in sufficient quantities to have an impact. The lack of ADH will cause an increase of water in the urine, which is also known as polyuria. If left untreated, individuals will experience polydipsia, a medical term for excessive thirst. So does everyone experience DI the same? So no. There are two kinds of diabetes insipidus, transient DI and permanent DI. In individuals with transient DI, their bodies are somehow compensating for the lack of ADH, and most of their symptoms are either minimal or they appear normal. In permanent DI, their bodies are unable to compensate for the lack of ADH. In this experiment, there were 102 TBI patients. There were 85 males and 17 females, all between 15 to 65 years old. There were also 27 healthy control subjects added to the experiment as a control group. Each individual with TBI was 6 months post-acute head trauma. Some things that could have gotten you excluded from this experiment are things such as pregnancy, renal disease, lithium treatments or other medications that are known to cause renal insensitivity to AVP, or vasopressin, or hypokalemia and hypocalcemia. So there were a couple of different reasons that you could have been involved in this experiment. So one of the first reasons is you could have been a victim of assault. You could also fall or been in a vehicular accident. So in this experiment, 43% of the individuals that had TBI received it from a road accident. About 30% of the individuals received their TBI from a fall, and another 12.7% from assault, with the last little bit, about 15%, coming from something that doesn't fall into those categories. Every individual in our experiment was put on the Glasgow Coma score. So just a little bit about that. The Glasgow Coma Scale is a clinical scale used to reliably measure a person's level of consciousness after a brain injury. The GCS assesses a person based on their ability to perform eye movements, speak, and move around. These behaviors make up the three elements of the scale, which is the eye, verbal, and motor. A person's GCS score can range from 3, which means completely unresponsive, to 15, which is responsive. Lower GCS scores are correlated with high risk of dying, but it should be known that medical responders do not just use this score alone to predict the outcome of an individual with a traumatic brain injury. In our experiment, About 55% had a Glasgow Coma score of 8 out of 15, which is more severe, while about 41% had a 9 out of 15 to 13 out of 15, which is less severe. So in the experiment, the WDT, also known as the water deprivation test, was performed on all patients and controls. Plasma and urine osmolalities, urine volume, thirst score, blood pressure, and weight were measured at time intervals of 2 hours. If the subjects lost more than 5% of their body weight, then they were advised to stop the water deprivation test. Anterior pituitary glands were analyzed for each individual separately.
Two parameters measured through the water deprivation test were urine osmolarity and urine volume. The top graph is urine osmolarity, and the bottom graph represents urine volume. The red line in the graphs represent those in the experiment who had permanent DI. As we can see, those with permanent DI had significantly lower urine osmolarity and significantly higher urine volume. This makes sense when we understand that permanent DI leads to lack of reabsorption due to lack of ADH. More fluid is excreted and will be excreted through the urine, making the volume go up, and more volume without more particles would of course lead to a lower urine osmolarity. It is also interesting to note that those with transient DI have levels on par with the healthy control subjects. This is because those with transient DI have not yet lost the ability to use negative feedback loops to compensate for the posterior pituitary's lack of function.
So plasma osmolality is defined as the number of dissolved particles in the plasma. So as you dehydrate, plasma osmolality increases. And so in normal individuals, ADH regulates this and doesn't allow too much fluid to leave. But as you can see in individuals with permanent DI, their plasma osmolalities increase at a more drastic rate than those without it.
Okay, another notable parameter is shown to us in this graph, and that is our plasma sodium concentration. Again, in red, we can see that those who had permanent DI have significantly higher plasma sodium concentration than the healthy control subjects. Now, one might ask why sodium concentrations would matter, and it's a good question, and the answer is because our body, when healthy, uses this sodium concentration to signal a negative feedback loop to let us know that we're dehydrated. So as we lose water, our sodium stays within the blood, and our blood volume goes down. So our sodium osmolarity goes up, and this tells the brain, hey, we need more water. And how does the brain respond to this? It tells us that we're thirsty and that we need to drink water so that our water levels can be back to where they're supposed to be. So it's interesting to see how much higher the levels are, because typically in a healthy individual, we only need to see a 2 to 3% increase in plasma sodium in order for our brain to recognize that we need water. As we see in this graph, most of the levels throughout these time intervals are much higher than 2 to 3%. In fact, as we get closer to the 8-hour mark of this experiment, we see that our sodium levels, or sodium concentration that is almost 10% greater than the healthy individuals, which of course shows us why we get so thirsty and why it's such a problem when we have diabetes insipidus.
So in this graph, you can see that individuals with permanent DI on the thirst scale are on average way thirstier than those with transient or non-DI or the healthy controls. So as you can see that actually after a while their thirst level does level off, but that's because they have no more water left to lose in the experiment.
In conclusion, this experiment has shown that in a large group of survivors of traumatic brain injury, there is a significant frequency of early and late posterior pituitary dysfunction, which of course is what leads to diabetes insipidus. Recognition of these treatable abnormalities is important to maximize the potential for recovery in this high-risk group of patients. The symptoms associated with disease can greatly damage a person's quality of life. It's hard to enjoy your daily activities when you're constantly needing to drink water and have to urinate every 15 minutes. Depending on the form of this disorder, treatments might include hormone therapy, a low-salt diet, or drinking more water. Typically, this is a form of DI that is treated with a synthetic hormone called demopressin. This medication replaces the missing antidiuretic hormone, which is ADH. This hormone will increase water reabsorption and decrease excretion or urination. You can take demopressin as a tablet, a nasal spray, or by injection. Most people still make some ADH, though the amount can vary day to day, so the amount of demopressin you need may vary. Taking more demopressin than you need can cause water retention and potentially serious low sodium levels in the blood.
Okay, so now we're going to do a quick check for understanding, just to make sure you guys are paying attention. So what is the role of ADH in the body? Go ahead and pause the computer and look at the answer. Okay, welcome back. So hopefully you put that the answer is C, water retention in the kidneys. So hopefully you know that once water has turned into urine in the bladder, it's not going to be reabsorbed from there. It will not make you fly like Superman. Hopefully you got that. And D, ADH is not midichlorian, so you will not be stronger in the force with that amount of ADH.
Perfect. The next question is, where is ADH manufactured and stored? So go ahead and pause the video again and think over this question. Okay, welcome back. Hopefully you came up with the answer B. It's manufactured in the hypothalamus and stored in the anterior pituitary gland. Once again, the kidney uses it, not manufactured or stored there, and your mom doesn't make it.
Well, she does, but
it's all right.
Not in a cookie jar.
All right, and the next question is, what are symptoms associated with diabetes insipidus? So go ahead and take a second to pause this and see what you come up with. Okay, and so hopefully you came up with D. So of course, extreme thirst and inability to retain water were probably the more obvious answers. It does not cause pregnancy, but then constipation and bedwetting were things we didn't talk about specifically, but obviously if you are lacking water and you're excreting it, then those will lead to those symptoms.
Just our last question. Which professor is most likely to have a devotional that lasts more than half of class? You guys know it. Have a good one. Thanks for watching.